compared to someone who's above 45, who probably it's ovulation or the sperms are not enough. Okay. Yeah, so once we do those lab tests, we check the sperm, but most of the time we start with the man.
Yes.
It's easier. It's not invasive. While as for the woman, even doing something like a HSG, that's a HSG is the one we check the tubes. It's very painful. It's uncomfortable.
Yes.
And you have to do it when you're awake, you know, only to find out the tubes are blocked. Yeah, so after that, then we manage each condition depending on our findings.
Okay.
Yeah.
I lost the sample, so many questions that are coming through. Then we'll get back to treatment options that we have. One of our viewers asking, good evening, what about men? And I think Dr. Karen has just mentioned about that, about the causes of infertility in men and also some of the things she would check for. Another viewer writes and says, thank you for being informed in the show and thank you so much for watching. My question is it possible to get pregnant between the 19th day of the cycle and the day of your periods?
It's important to note that everybody has different cycles. Most of the time we say you are around 90 to 95% likely to conceive around mid-cycle, from around day 11 all the way to day 17, depending on your type of, because you have 28-day cycle, 32-day cycle, 21-day cycle, your time might be different, especially the mid-cycle. Most of the time, as you go closer to your period, you're less likely to conceive, but we've had cases of people who still conceived even when they're on their period. You know, or just before, because their ovulation might not be the same. Not everyone has the same cycle.
Yes.
Yeah, so, and there are people with polycystic, we don't know when you ovulate. Yeah, so if you're having, it's called an ovulation, it means you'll not ovulate, but at some point when you ovulate, we don't know when you do. Yeah, so I can say yes and no to that answer, depending on the cycle that we're talking about.
Okay. Thank you, Avia, for your question. Another one writes and says, hi, please ask the gyna, can hydrosulfins, hope I've gotten it right, healed by antibiotics? And what of small ovarian cysts, does it have medicine?
For hydrosulfins, what that means is fluid in the tubes. Yeah, so the tubes now fill up with fluid, probably because also there's some level of blockage. So the fluid that is supposed to be moving around in the tube is not moving as expected, and it fills up in that tube. It's not an infection. An infection is different. Now that's a pyosulfins, that's a different name, where you have pus inside the tube. That's different. So hydrosulfins does not go away with antibiotics, unfortunately. It may resolve on its own, but at the same time, what happens to that tube, it doesn't necessarily go back to the normal, because tubes are very sensitive. Any small thing just disrupts the tube. So if you have hydrosulfins, then it means that expansion just damages the contractility of those tubes. So you'll find most of the people with hydrosulfins, we actually offer to remove the tube, because the fluid in the hydrosulfins might actually make it that it's toxic to any pregnancy that's in the uterus. Okay, so that's the hydrosulfins may resolve on its own. Some people use antibiotics, but does not necessarily treat that. Even for pyosulfins, where you have pus inside, we might have to actually go in and remove it using minimal access procedures. For small cysts in the ovary, it depends. Are we talking about less than? So if you have a cyst, where that egg came out, it leaves a space. And that space might close up and leave some blood or some fluid, inside, which sometimes for some people becomes bigger and bigger, but it can resolve on its own. Because if your hormones are well balanced, then you're supposed to, the cyst should, rupture on its own and you should be fine. Difference is if it's polycystic. Polycystic and just one cyst is different. Yeah, polycystic, there are a certain number of a certain size, and it's causing you to have other things that are, it shows that you have a significant level of testosterone in your body, either hirsutism, which is the hair growth where it's not supposed to grow. You can have a beard, you have acne, you are either obese or thinner, and other issues like diabetes and hypertension, which can follow. So that is different. So it's either if it's polycystic, we manage with medication, diet, as I always say, diet is key. And exercise, moderate exercise is good, which if you can lose 5% of that weight, then you can actually significantly improve how your ovary works, and you might actually start ovulating. But this small cyst might not cause any issue. Problem is if it's more than 4 centimeters, 6 centimeters, when it can twist on itself, and that twisting blocks the blood vessels from going to the ovary, and then you get another problem.
Okay.
Yeah.
Wow. Okay. I'm 35 years of age, our viewer says, and just turned 35 in March.
Yeah.
Happy birthday, late birthday. And they write, I have been noticing that my ovulation days are few and started getting my periods on ovulation. And last period I got them for 3 days. Could there be a problem? And again, I have been using emergency pills after intimacy. Could it be the cause?
Anything that we use in our bodies always has its own effect, and especially the emergency pill. The emergency pill is only for emergency. We really recommend, I think, and I hope one day we can be prescribing this drug rather than it being over the counter, or you can go and buy it, because now it's being used so commonly, and it causes, it's high dose of progesterone, very high dose. And what happens is that it changes now your hormonal, your menstrual period. Either it comes earlier or it starts to reduce, or if you use it in the same month, you can even get pregnant, because you wanted to prevent pregnancy. But now when you use it in the same month, you disrupt your whole system, and now you ovulate the time we don't expect, and it's easy to get pregnant in that situation. Yeah. So probably it could be the cause, but again, as I said, being above 35 years, then, and there are other factors like smoking, alcohol use, your environment, toxins, how your childhood was, any exposure to any form of toxins, those can reduce your egg, whatever is remaining in your ovaries, and then you tend to have changes in your hormones after 35. But it's a bit earlier. From 35, we expect it to reduce, but not to end. Okay. Yeah. So it may be a sign that she could also be going into, she's going into premenopausal stage. But it's good for her to have a gynecology review her.
Okay. One of our viewers on our SMS line 22232 asks, if my ovulation kit shows positive signs, does it guarantee ovulation?
It has. It's what the kit does. It checks there's a particular hormone we look for that shows that you have ovulated or you're about to ovulate. It's called the luteinizing hormone. So that rise that you see, it means that yes, you're going to ovulate. It gives you, it's a good predictive value, but again, it is a manufactured thing in the, it's manufactured by human beings. So if one kit or another might not give the exact findings, but most of them will give you at least a good predictive value.
Okay. Somebody else asking about the fertility test, how much will it cost? That before you answered that, another says, a husband writing in. We always value husbands when they write in on behalf of their wives. Thank you so much. And says, my wife alifanyiwa operation ndio asipate mtoto kitambo. But last year, balls mbili zilitoka. Possibly za kupata mtoto. What is the possibilities za kupata mtoto? Daktari, please tell us.
Okay. So I think what they mean is that they had a tubal ligation. Surgery to prevent pregnancy is closing the tubes. And there are different ways we do it. We either close and cut, or we clip them, or, we just cut and funga them, or just, but most of the time for us, what we do is that we close it and then we cut it. So there's no communication between the tubes. Unfortunately, and I should say this, sometimes there's no 100% in medicine. Even everything, there's no 100%. Yeah. There'll be that 99%, there'll be that 1% that will come back and say either it recanalized, maybe for some reason it went back together. And fallopian tubes are very sensitive, so even if they went back together, they should have caused some scarring, no possibility of getting pregnant, but it is possible to get such things. You might want to have a review with a gynecologist so that you can find out exactly whether your tubes, but by the time they're getting pregnant, it means they either recanalized or I can't explain really much because I didn't, it's not easy for me to explain someone else's surgery, but it can happen. It's not impossible. I think the other one, they were asking about treatment.
Yes, treatments, diagnosis for infertility.
Yeah, so what is the cost of the test for fertility?
Yes.
If, there are many tests. Are we talking about the men test? The men test
is it a standard thing, or maybe you could give a range? It depends. Depending on where, again.
And it depends on the type of test we are doing.
Yes.
For men, we look at the sperm. And there's a whole process behind how to prepare before you get ready, the whole procedure. And when we do it, it depends on every hospital how much it would cost. I may not be able to give an exact value, but getting the sperm is not as expensive. If you're doing a HSG for women, some places, if you're in a government hospital, should be around between 5,000 and 10,000. And that's for HSG. Other places to cost more.
Okay.
Yeah. If you're lucky, you get the cheaper ones. And then there are other tests like hormonal tests. Hormones are quite expensive, especially when we are looking for things like your egg reserve. Those are the hormone tests that we'll do. Hormones are expensive. They go up to 15,000. 19,000 for just a few hormones.
Okay.
Yeah, but I encourage you not to be afraid because it's not always that we'll do these tests on you. Yeah, they'll just be those ones. Sperm is very easy.
Wow. My director whispers time is up. Oh my.
You haven't spoken so much.
I know. But I promise we'll be able, for the questions writing in, we'll be able to reach out to Dr. Karen. And for those who'd love to get in touch with you, how can they do that?
Yes. So they can find me on my Instagram, Muthembwa, and also my foundation page, which is where you'll get most of the responses at this point. It's called Dr. K Foundation. You can find it also on my Instagram page. There's a telephone number there where you can call in. That's my assistant. They can call in, and because some people think it's me, you won't get me directly, but the information will get to me.
Yeah.
Then you can book an appointment.
Dr. K Muthembwa on Instagram.
K Muthembwa, K-M-U-T-H-E-M-B-W-A.
Yeah. And the name is right here at the bottom of your screen.
Yes, and the foundation page.
And the foundation.
Yes.
Thank you. Your parting shot for couples, still at that place. Maybe they just got that bad news today. There is an issue. In a minute, then we wrap it up, please.
Wow, I really understand them. I am, as I see my patients, I pray for them. I do. I pray for all those people who are listening right now. I know it's a tough thing, but not all, hope is still there. Just be hopeful. There's nothing else to lose. Be hopeful. Go to the hospital, get the doctors to help you however we can, because we are ready and there to help you, regardless of who you are, without any judgment. The other thing is, people outside there should be very sensitive to married couples who have not conceived. Maybe they don't want to conceive, but maybe they do, but it's none of our business to keep asking them when and where. When are you getting a child? When are you bringing us a child? Because you might come from a very good place, a very happy, worried, you're caring, but it can be very hurtful to someone who's actually going through fertility issues. Yeah, we should just be sensitive to each other.
Thank you.
Yeah.
Thank you. Thank you, Dr. Karen. God bless you. Looking forward to doing this again.
Yes.
Maybe a part 2 where we'll just answer questions.
Yes.
On fertility. Thank you so much for watching us tonight on Health Check. My name is Grace Mutisa. I've been hosting Dr. Karen Muthembwa, an obstetrician and gynecologist focusing on fertility in women. I hope you've learned a thing or two. Remember to catch this repeat tomorrow at around 10, 11, right here at Top TV. And also anytime you can watch us at Top TV Kenya on Facebook and YouTube. Of course, the program will be uploaded there shortly. And my parting shot is, please, just leave that couple alone. If you're a couple, you've been trusting God for children, please go for check. Don't fear visiting the doctor. Husband, take your wife. It's important you go together. Wife, cooperate. Yes. Go see the gynecologist. And of course, if you're a parent-in-law, a friend, a colleague, stop asking them when they'll get children. Maybe they just had a miscarriage and they are mourning and you're busy there asking. So it's none of your business. Pray for them. That's the best place to be. My name is Grace Mutise. I wish you a blessed night. God willing, let's do this again next week. Shalom and God bless.